idea. And it's one thing that gets talked about a lot, but what doesn't always come easy is how to do this. But inequitable community conditions are at the root of most societal problems. It's why our zip code can predict how long we live, the quality of our life, and determine if we will end up in college or prison. We're going to spend the next hour sharing the tangible framework we use at IPS to expand equity in communities. But first, I'm going to introduce our lineup of speakers, starting with Sarah Blanch.
Good morning, everyone. I'm Sarah Blanch, and I am the Vice President of Organizational Development at the Institute for Public Strategies.
Good morning. I'm Brittany Hunsinger, Program Manager for the Partnerships for Success project down in San Diego at IPS.
Jorge, yeah.
All right, that's a great start. Hey, hi, my name is Jorge Castillo. I'm the Advocacy Director at Alcohol Justice, and I want to thank IPS for inviting us to the conversation.
Today, we're going to be going in depth into a couple of real world projects working to advance equity. And we really, really hope this is going to be useful for you and that your work and that you can bring this back to your coalitions. So the Los Angeles Drug and Alcohol Policy Alliance, which we'll be calling LA DAPA throughout, is a project that was founded in 2012 with a goal to empower communities, and particularly communities of color, in the city of Los Angeles. And Alcohol Justice is the lead agency on LA DAPA, and IPS has been involved from the beginning, but we're very happy to have Jorge from Alcohol Justice here to share his perspective.
And so I'll be speaking to the Partnerships for Success project. I will be calling it P4S throughout or using it interchangeably. So just wanted to let you know that. And so with P4S, we're really focusing on the unfair neighborhood conditions that negatively impact health, like unsafe parks, lack of access to healthy foods, limited healthcare services. These community characteristics, they often lead to substance use, adverse childhood experiences, community trauma, and toxic stress, and they really shorten the lifespan of the people who live in the neighborhoods.
Thank you. So let's kick this off. Please feel free, as questions arise, put them in the Q&A panel, and we will leave time at the end to answer your questions. The webinar is going to be recorded and will be available on our YouTube page, which you can find a link to that on our website. And we are also going to provide everyone a link to our Act for Equity toolkit at the end of the webinar. So we hope you stick around. Let's start by getting on the same page with equity. When we talk about equity, what we mean is just and fair inclusion in society. That the society is equitable when everyone can participate and prosper, and that our goals are really to create conditions that allow everyone in the society to reach their full potential. If you've taken the time to be here, you know why advancing equity in communities is valuable. The challenge is how to do this. Let's start with some basic assumptions. First, we can't solve inequities by encouraging individuals to behave differently. We have to focus on the community and social conditions that produce problems. If you think of, if any of you have fish and you think of a very healthy fish, I know we have some fish lovers in our midst. And you take that fish and you put it into a dirty fish bowl. It's not going to thrive. And it has nothing to do with that fish. It has to do with the fish bowl. And that is why we, under that same premise, focus on community conditions rather than trying to teach fish how to change their behavior. The most meaningful and lasting changes are also the hardest to create. That's our second premise. They require a persistent focus on policy and systems change. And so that is the framework that we're providing today. Will focus on changing community conditions through policy and systems change. And based on almost 30 years of experience, our organization has developed a model or a framework for preventing community problems. It's been applied to address problems ranging from underage drinking to human trafficking. We call it our ACT model, and you can see it up here on the screen. ACT stands for Approach to Community Transformation, and the model is meant to be applied in partnership with communities. As you can see, it has 6 components that are strategically interconnected, and I'm going to provide a brief overview of the various components of the model as we move through the webinar, followed by a dive into how the model is currently being used by Sarah, Brittany, and Jorge to advance equity in their communities. Community transformation, that's the central component of the model. And when people look at the model, they see the outside components and don't always pay attention to the central component. It is the critical component. It's the vision for change that you're trying to achieve. And it has to be, again, identified in partnership with communities. And if we move into the strategies, the community organizing and the media advocacy and the policy goals and those kinds of things, without putting our vision down first, we're probably going to be wasting a lot of our time. To illustrate this, let's start with Jorge's experience.
So thank you, Brenda. The Los Angeles Drug and Alcohol Policy Alliance understands that current social inequities affecting marginalized communities of color and low-income communities originated from past deliberate exclusionary acts that were enacted into laws and policies. Laws that for generations limited people's potential in the areas of education, employment, politics, housing, and health. DAPA understands that we need to take deliberate action to modify and reform these conditions that continue to exist today. Specifically with alcohol, its harms are directly linked to the exclusionary and unequal application of zoning laws. Therefore, the vision of DAPA is to create a mechanism to empower historically marginalized communities of color and others that have been historically excluded so we can achieve the needed alcohol policy change in our community.
And so for P4S, our vision is to increase the prevention infrastructure and build capacity of the community to really prevent substance misuse among the Latino population in the South Border region communities of San Diego County.
So the vision, when we're applying this framework to equity, I mentioned that the vision needs to be established in partnership with the community. But what I forgot to say is it's not just anyone in the community. It needs to be established in partnership with the community who are most impacted by inequities or problems. And once your vision has been established, the rest of the components of the model or the framework can be strategically threaded together into an action plan. So let's take a look at what that looks like on the ground. One thing to keep in mind, it's not a step-by-step model. It is a model that takes into account the community you're working in and the nuances of that community at that point in time when you're doing your work. So it is flexibly applied to make sure that it meets the needs of your community members and the community you're working in. It's not a cookie cutter process, but it is one that allows for creativity and allows you to adjust and be flexible as you go along. The first component is the data and research component that we'll talk about. And this is about, you do data and research for a lot of reasons, but really what it's about is identifying the root causes of problems, the inequities they create, and the health disparities. And you actually kind of do that in reverse order. It's easier to define the health disparities and the inequities that cause those health disparities, and that'll get you to the root causes. So that is part of what we do with the data and research component of this framework. And so let's look at what that looks like in the field.
Thanks, Brenda. As Brenda was saying, at LA DAPA in terms of data and research, we really use data to attempt to tell a story. And that is to get to the root cause of community problems. So our comprehensive assessment led by LA DAPA led us to understand, as Jorge mentioned, that a community condition contributing to a range of serious problems in LA neighborhoods was the retail alcohol environment.
To add to what Sarah mentioned, research shows that alcohol impacts communities of color and low-income communities disproportionately, even though these communities consume less alcohol. And this is true not only in Los Angeles, but in general, mainly in part because alcohol problems tend to be criminalized in communities of color. There's less access to health services. And alcohol overconcentration is common in communities of color and low-income communities. What the data revealed in Los Angeles is that alcohol overconcentration means more injury, more harm, and more crime. As you can see on the screen to your right, we have an example of an alcohol fact sheet right at the top right-hand corner. For efforts in LA, we took current data and research and summarized it into a plain language to make it accessible to members of the Alliance, also to make it accessible to the general public and to policymakers. Because we feel that research shouldn't only be accessible to academics or policymakers, it should be accessible to those that are affected by it.
We also wanted to supplement the quantitative analysis with anecdotal data. So we conducted a series of key stakeholder interviews with 15 core community groups throughout Los Angeles neighborhoods, including in areas with large Latino and African-American communities. And here we are pictured on the right, conducting some of those interviews. Time and again, we found over the course of this process that the interviews identified extreme alcohol outlet density as a contributor to blight, to crime, and to negative health impacts, particularly in economically depressed areas. These interviews also made it clear that the community groups in these economically depressed areas had really been historically disempowered to change it.
And so data and research for the Partnerships for Success project, it's been really our primary focus for the past year. So our funding started October of 2019. We've really been focused on our needs assessment, so gathering that quantitative and qualitative data that Sarah and Jorge just mentioned. But one unique approach that we've taken and that we're really excited about is through using Geographic Information System, or GIS mapping, to understand the existing health disparities. So let me show you some of the maps that we created. So we created these 3 maps that overlaid Latino population density with 3 different indexes that provide context for the conditions in the South region. And so right here on this first map, this is the Child Opportunity Index, and it's a composite index that captures neighborhood resources and conditions that matter for children's healthy development. It focuses in on 3 indicators across 3 domains. Those are education, health and environment, and social and economic. The second map is the Neighborhood Conditions Index, or Adverse Neighborhood Conditions, and it's a domain of the Healthy Places Index. It combines measures of park access, tree canopy, supermarket access, retail density, and also off-site alcohol outlet density and traffic density. And then the third index is the hardship index. And so this index is a composite of 6 scores. It looks at unemployment rate, dependency rate, low education attainment, per capita income, housing overcrowding, and poverty level. And so what we did, or I should say what our evaluator did, is to help us narrow in geographically, she created a map of the census tracts that came up the most frequently as having the highest proportion of Latina residents and the highest disadvantage. And so this is providing us with that empirical method that we need to really choose where the grant resources are of most need in the community and where we can focus in on.
Great. So now we're going to move into talking about the community organizing component of this framework. And one key part of that is engaging the populations most affected by the inequities, from the visioning, like we said before, to the community organizing throughout the project. And what you'll see here is that the community organizing intersects closely with the data and research component and the other components of the model. One example is the key interviews that Sarah talked about a few minutes ago, and how they were really able to understand the problems from those key resident interviews. And then those key residents become part of the community that you're working with to advance the vision that you've selected.
Community organizing for P4S, what does that look like? So in the beginning of the project, we knew that we needed to bring together a strong core group leadership team or advisory team. So we were still learning and gathering data, as a new project at IPS. We needed to know what was going on before approaching the grassroots community. And so we started at the top with the intentional recruitment of key stakeholders to build collective power, break down systemic barriers, and break down those silos that people were working in. So how did we do that? We created a list of different sectors and individuals that we felt were critical to the goals of this project, whether it was, looking at the healthcare sector, behavioral health, those policymakers, and other key community-based organizations that were serving the residents. And so we didn't reach out to them and just simply ask them to be in our core group. We thought that we would take this approach of, we want to talk to them, we need to gather information anyways, so let's approach them and just ask them if they'll participate in our qualitative data research and participate in a key stakeholder interview. And so that's what we did. However, this phase really happened at the start of the pandemic. And so, of course, we were met with interesting circumstances, as you all know. And it was really hard for us, especially as we tried to reach out to those organizations that didn't know us, had never heard of us before, or had never worked with us before. And so we didn't want to speed up the process. So we knew we had to remain flexible. And I think that's really key and really goes back to our model, is just remaining flexible at all points. And so fast forward to May of this year, we successfully convened our first core group meeting with 13 members, all of which are very invested in serving the Latino community. Majority grew up in the South region and represent our target population. So they're not only able to offer us that professional experience from the grass tops, but also their lived experience, which is very important to us. And we're also approaching this project not making any assumptions of anyone's knowledge. And so we're conducting workshops to build capacity of my team and also our core group. And we'll continue offering those workshops to train them and hope that they'll take what we train them on and pass it on to those they're serving, or bring us in to train the population they're serving. And that'll allow us to reach our target population and ensure that they have a seat at the table every step of the way. We'll also leverage the networking capacity of our core group to expand our community organizing efforts in the upcoming months. And so that'll help us build that broader coalition of residents, youth, other organizations that might not have, you know, a rather large time commitment to give to us, and just be that community of advocates that the program really needs to be successfully implemented.
Okay, so what does community organizing look like with LA DAPA? From the beginning, we worked to build power in these disaffected community groups, bringing them into the process. And an area of specific success is a group that we affectionately refer to as the Moms. And the Moms are a group of Latina women who are passionate about alcohol problems in their neighborhoods. They've experienced firsthand the impacts that it's had in their communities. And here we are pictured with the moms on the right at one of our many trips to City Hall. And I think one of the major factors that has helped us be successful with this are real practical considerations, giving them what they need to bring into the process. Obviously, Spanish translation has been a very important part of this. Here we are on the right, we're pictured with the translation headsets. And actually, we've gotten to a place where we conduct every other coalition meeting in Spanish, so the translation is into English to really accommodate them and bring them in. Also, transportation has been very important. We've been organizing, literally renting vans and picking them up and giving them what they need to get to the press conferences and rallies and meetings with advocacy makers. That's been a really important factor in being successful with them and bringing them in. Jorge is going to talk a bit about the training that we've done.
Thank you, Sarah. I think it's also important to note that it takes a while to create an effective alliance or coalition. LA DAPA has been around for 13 years under different names, and it's been the last 7 years that have been the most successful. And to go back to our conversation, after LA DAPA members understood how alcohol impacted their families and communities from a systemic perspective, we then began the process to address the issues at a policy level. As Sarah mentioned, in order to build capacity, we set out to develop the skill sets of members in the areas of media advocacy by developing talking points, conducted media interview trainings. And in the areas of policy, we focused on setting up meetings with local elected officials and prepared members to talk at city council hearings. More importantly, we intentionally worked to get the authentic voice of the members to rise up. We also worked to hand over decision-making power to them. And that took a couple of years, about 3 years, I would say, once we were established. The LA DAPA also evolved currently to the point where we have co-chairs in communities that manage the issues and are headed by the membership. The committees are specifically focused on research, policy, community, and communications.
Great. Those are great examples, and it's nice to see the contrast between the two. I want to move into media advocacy, but I do also want to point out something that Jorge said about engaging those authentic voices, because this is something that you do through your community organizing, but you also do it through your media advocacy. You use news and other strategies related to media to amplify voices, elevate issues on the public agenda, promote collective responsibility, and really prompt change. But for your media to be credible, it needs to be backed up with data. It needs to show that what you're working on has some research validity. It needs to if you're trying to advance equity, it needs to elevate those voices of those people who are most impacted by community problems. And media advocacy, I talk about it a little bit more here for a second, because it really is the tool in our toolbox and the component of this framework that can set the pace and build incredible momentum for what you're wanting to do. It can create a tipping point overnight sometimes. It is such a powerful and underutilized tool. And so I'm gonna turn it over and have you guys have our panelists talk about how they use it out in the field. But I just cannot stress enough that of all the components of our framework, this one tends to be the most underutilized in programs across the nation that would just really be a game changer if we would utilize this fully as a tool in our toolbox.
So like I mentioned before for P4S, this past year, we've really been focused on our needs assessment, looking for the root causes, the root causes of the existing health disparities. That doesn't mean we haven't been using media. As Brenda mentioned, we should be working media into every aspect of the model, no matter where you are in your program. So we've used this time to illuminate issues and shine that light on the inequities that have risen to the top, especially during this past year. With COVID and other major events that have happened. And so we use this opportunity to show how these mainstream news topics were impacting health and safety disproportionately, especially in the communities in the South region of San Diego County, and allowing that to build, using our media to build support for systems-based solutions. So you can see here on the right, some of the earned printed media that we had published. And we've also used this time in response to the pandemic to create these branded campaigns, due to social isolation that the pandemic has created, and hearing that residents who, historically have been hard to reach or even harder to reach now, we created these to communicate the importance of topics and inform the communities of important things that were going on. So we created a campaign around voting, letting them know, their rights and everything like that. And then one about participating in the census, knowing what to expect when a census taker comes to your house or calls you, depending on what point in time that was happening during the pandemic. And then we have a third one on contact tracing in the works. And so these bilingual toolkits that were created included a flyer that could be used, an email blast posted at resource centers, distributed at community events like food distributions that were going on during this time. I know not a lot of community events are going on. And also included infographic and video designs for all social media platforms. And my team built this amazing instruction kit that included hashtags and captions. We wanted to make it as simple as possible for everyone and anyone to use this and be able to help spread the message.
To expand on what Brittany just talked about, we use LA DAPA utilizes media specifically as a tactic to pressure and educate decision makers. And that is because we focus only on policy and making demands from policymakers. There is no better way to get a decision maker to support us than to have them read about how they are not helping us in the front page of a local newspaper. To achieve this goal, we organize press conferences and rallies to bring attention to alcohol overconcentration and associated alcohol harms. Here to the right, we have a picture of our membership holding a press event and rally at the Los Angeles City Hall building in downtown LA. You may ask the question, does media have an impact? And we have proven that it does. A few years ago, one of our policy motions that addressed alcohol zoning was on the verge of dying in a committee. But thanks to an email from an LA Times reporter sent after one of our press events to the LA City Council president that inquired about the status of a motion, thanks to that email, the motion was extended 1 year. We discovered this fact through a public records request. Up to that point, we thought we had done it. but it was actually the email from the LA Times reporter that allowed us to go over that hurdle. We have found that media is very effective and building good relationships with reporters is very important in policy work.
And we also use social media to amplify our efforts. It's been a really strategic, we found some very interesting strategic applications that we've been excited about. Of course, LA DAPA is on Facebook and has a Facebook page, but in regard to media, Twitter's been a great tool, a great tactic for us. Obviously, reporters, media have a big presence in the Twitter universe. So we have a network that we've developed with 150 Los Angeles reporters in, broadcast, print, radio, media outlets throughout the LA County and LA City areas. It's a great opportunity to amplify what we're doing every time we're having a press event, every time we're having a rally, anytime we do a press release. We've really been able to, as Jorge was saying, those relationships are important. We're able to raise this above the noise, these issues, understanding alcohol density. A lot of the average person doesn't understand that alcohol density has such an extraordinary impact on public health and safety. It's a very big access point for community. So it's just been really bringing that story, and also that what we've learned through the research about its specific impact in LA. There is interest in those stories. So, and just lastly, I wanted to say we just did a Twitter chat in partnership with Alcohol Justice as well. That's a really interesting new forum for driving community interest and also getting media engagement. Really promising, interesting new way to be using Twitter to amplify media. And we're going to be doing a webinar on tactics like that at a later date.
So before we move into policy and systems change, I just want to reiterate a couple things about media advocacy, or point out a couple things. One is that traditional media advocacy really uses the news or earned media. We're going to have a tool in our toolkit for you to look at the things that you think about when you are doing earned media or generating news, opinions, and other things to strategically support your goals. And you can see media advocacy leads into policy and systems change because the two are tied so closely together. Your media advocacy supporting policy and systems change, which again, this is challenging work to advance policy and change systems, but it's the most powerful approach to actually creating change that breaks down structural barriers to equity. So if we can kind of keep our eye on the ball, sometimes that's hard, but that's what's going to move us over the line in communities as we're working with the different sectors to actually make our communities more equitable. And so this is a model that we thought was really useful in, it's kind of abstract the way I'm talking about it, but basically priority problems and factors reflect where a community is. So this comes from your data collection and working with your communities and setting your vision, but priority problems and factors reflect where a community is. Anticipated outcomes indicate where it wants to go. And to capture these key decisions and inform the selection of programs and practices to move a community in the right direction, we can build a logic model. And basically it's a planning graphic, and it's a tool that makes it explicit the rationale for selecting programs and practices by presenting the relationship between problems, associated risk and protective factors, selected programs and practices, and anticipated outcomes. Now, that was really boring, but what we're going to do is I'm going to turn it over to the people working in the field, and they'll show you how this actually is a useful tool to help you kind of lay out a roadmap so that people understand what you're doing and why you're doing it.
Thanks, Brenda. Yes, let's apply a real world scenario here. So policy and system change for LA DAPA. If we're using this logic model that Brenda just referenced as a framework, our prioritized community condition was the blight, the crime, and the general negative health impacts of alcohol in Los Angeles neighborhoods. And the risk factor is the extreme density of alcohol outlets and over concentrations. In fact, sometimes over 300% beyond the recommended limit in many census tracts throughout Los Angeles. But what does it look like? It's actually manifesting in very different ways in different communities. On the West Side, there are a number of upscale restaurants that are getting built in pockets, in neighborhoods, in very close proximity to family homes and family structures, literally in some instances across a 13-foot alleyway to someone's bedroom window. Lots of noise problem, lots of quality of life problems. And that's the way density is having an impact in there. And of course, in addition to drinking and driving and the more serious aspects. But then in some of the other more economically depressed areas, as we mentioned, there historically have been these pockets where there are liquor stores and markets that have been historically can be centers of community blight. Of course, not all those businesses are bad actors, but it's contributing to an overarching problem. So just all that is to say, manifesting very differently in what it looks like. So that led us to our policy recommendation, which is a promising intervention based on a model provided in San Francisco over a decade ago, the Alcohol Restricted Use Subdistrict Ordinance, what we'll be calling ARIS. And as you see here on the right, that's our ARIS press kit there. Now, the way ARIS works is it's a flexible zoning tool that manages alcohol outlet density by establishing high risk zones where no new alcohol outlets would be allowed. And that could be in areas where the density is already extremely high, or there are youth sensitive areas or high crime areas, if a city council district chooses to implement an ARIS. So the thing that we think is very effective, particularly from an equity perspective, is that ARIS is flexible. It can apply to on-sale outlets, it can apply to off-sale outlet, it can be applied uniquely to each neighborhood's risk factors. So it allows for that flexibility. So it's been a long road for ARIS. We've had literally dozens of meetings with legislators, with our coalition. We've been at public comment in dozens of hearings with our coalition. But at this moment, we have over 15 LA neighborhood councils that have formally supported ARIS, and we have city council members who are interested and are talking about attempting a pilot. So that's where we are, but we're also looking ahead.
And as Sarah mentioned, we understand that alcohol overconcentration is a serious problem, regardless of how it manifests itself in Los Angeles. We also understand that in order to get support from our policy efforts, we need to make our campaign accessible to the general public and community members. As Brenda explained, the logic model is not something that is easy to present to community members. You have to present it in another way. And to address this situation more directly, LA DAPA over this last year has been developing the Believe in Empowered Neighborhoods Environmental Prevention Campaign, also known by the acronym BIEN, which aims to integrate evidence-based prevention practices to address the social inequities and health disparities linked to alcohol zoning laws in historically marginalized communities in Los Angeles. The word bien translates to good in English, to the word good in English. And it is a positive word and a concept that gives people a vision of the type of communities that we would like to have. Of course, if we don't like the situation, we're going to say that's not bien, and we're going to make it. We're going to work to make things bien in our neighborhoods in LA.
So for P4S, we, policy and systems change and selecting these interventions. This is really where we're at right now. But our hope is that, we can really look at addressing the unfair neighborhood conditions that will reduce chronic stress, community trauma, and adverse childhood experiences. And then those will effectively, combat the substance misuse indicators that we are also looking at. We're currently producing our needs assessment report, and that's really going to be used as just that comprehensive reference point for our core group and then also for my team. It'll allow us to identify systemic barriers to equity in the region. So that includes all of that qualitative data that we gathered from our key stakeholder interviews, as well as the quantitative data looking at hospital discharge rates, rates of underage drinking, binge drinking, treatment data, and then the indices that I showed you earlier that look at the community conditions. So this process will also look at those not so easy to measure community conditions that exist. So the existing landscape of the systems that are already in place. So education, parks and rec, healthcare, behavioral health, the justice system, and so on. So what I'd like to do is just take it back to that logic model that Brenda presented, because like I said, my team with our core group, this is where we're at. We're at this very stage in our program of looking at possible interventions now that we've collected all the data. And so when complete, the logic model will really be our plan for addressing our priority problems that will be set by our core group. For some communities, they may only have the capacity to support a single prevention program, policy, or practice. And those communities, they should be strategic about selecting the one that's going to have the greatest impact, as Brenda mentioned earlier. For us, and when and where possible, we'll be taking that comprehensive approach to prevention. So looking at hopefully multiple policies, programs, practices that are designed to address those different risk and protective factors in our community. That'll really affect, homes, schools, healthcare, all of those systems that are already in place. And so for this project in particular, we expect that those policy goals will likely include both institutional and public policies. And from there, we'll really determine what's a good fit, both conceptually, practically, and what's going to have the greatest impact and be feasible politically and resource-wise for us.
Thanks, Brittany. And before we move into sustainability, I just wanted to say, a lot of what we work on and what the people who joined us today probably work on, and you may not even recognize it, is you work on broken systems. And oftentimes they're really entrenched, they go very deep, and you're identifying those breaks in the system and trying to address those. And it's one way to look at what you're doing. And just understand that like Jorge talked about, the retail alcohol system, there's a lot of breakages in there that have created inequities over time. And, most of the inequities we see are due to broken systems, education systems, or justice systems, or those kinds of things. So it's just a way to couch how we think about this work. And we'll move into the last component we're going to talk about, which is sustainability. And while we're talking about it last, it certainly doesn't come last. It starts on day one. And part of sustainability is cultivating a sense of community cohesion, building capacity within the community, and fostering collective efficacy amongst partners. That means their belief that they can create change and their actual ability to work together collaboratively to create change. And so let's talk about what that looks like on the ground.
As Brenda said, it is true. I think all of us here know this. Sustainability is a challenge in public health. How do we keep the project going beyond the funding cycle? That's the ultimate question. So for us in LA with LA DAPA, sustainability has been a consideration from the beginning, and we're accomplishing it in a couple of ways. The first, as we've already referenced, is we are engaged with and working in partnership with a trained and a passionate and committed coalition of community members who are dedicated to the work and who now know how to advocate for themselves. And that work is ongoing. Secondly, we're advocating for upstream solutions, upstream policy changes, truly systemic change. And ARIS is a perfect example of that. It really is a land use revision. It's new land use regulation that would support more equitable development, that would protect public health and safety. So we believe that this type of systemic top-down change is lasting.
And I agree with Sarah. It ain't easy when it comes to sustainability. We think that to achieve sustainability, LA DAPA needs to diversify its approach to alcohol issues. We need to convince health departments, health and human service agencies, foundations, and elected officials that we can achieve better outcomes if we collaborate and intersect with related issues, which would open up funding from non-traditional sources. Some intersectional issues can include education, housing, homelessness, incarceration, urban design, and food justice. There might be opportunities for sustainability if we can devise a way that allies can also share resources and even integrate existing programming into our efforts. For example, by having member agencies put elements of our Bien alcohol policy campaign into the work plans. We should also aim to acquire non-restricted funding. You can do a lot with relatively small amounts of unrestricted funding.
And so as Jorge, Brenda, and Sarah all mentioned, sustainability can seem like a daunting task, especially for a relatively new project in the midst of implementing programs or mobilizing a coalition like Partnerships for Success. However, I believe by incorporating sustainability, like Brenda said, into all aspects of prevention efforts, whether it be assessment, like we're in right now, planning, which we're currently doing, or implementation, or even evaluation, it becomes an achievable goal. This emphasis on sustainability will actually strengthen prevention efforts from the very beginning. And so what does that process look like for us? For my project, for P4S, it's been getting that commitment from the right people in our core group, as I discussed earlier. So those who live in the community and have jobs related to the goals of the project, and those relationships, those key relationships with our target population. It also meant focusing on team building, particularly in this virtual environment. Our project started last October, and we've been community organizing in this new virtual space. So we've been learning as we go. But everybody, we've really been trying to just provide that social time that we're no longer getting before or after our meetings, providing the space to cultivate our core group's commitment to our projects, but also to each other and to each other's organizations. Each of our core group members have also signed memorandums of understanding, and that's just really committing their support to our project, but also committing to take responsibility for replacing their position or their sector if they have to leave for whatever reason that might be. Because we want to ensure that we don't have that sector lost or trying to scramble and try to find somebody who represents their organization. That's something we wanted to be sure to build in. And while IPS has taken lead for now on the project, after 3 or 4 years, the hope is that we just become that technical support and the core group will take the lead. So, as I mentioned before in our mission, the project's built to increase that prevention infrastructure. So by the final phase, sustainability should be naturally occurring. The coalition will have its own infrastructure built with its own leadership team. There will be trust amongst the members of the coalition, and it will have been well established. The capacity of the coalition leadership and the members will be advanced. The partners will be integrated and working together on those mutually, beneficial prevention goals and priorities, and hopefully leveraging those funding streams and resources, as Jorge mentioned. New policies, practices, and programs will be in place, hopefully, once we select those very soon. And then we'll have an implementation and evaluation plan, and those will be evolving. And so our core group and our coalition, they'll have gone through the process. They'll know how to pick these policies, practice, and programs that are informed by data, and they'll know how to evaluate where they're at and if they're working, and if not, they'll know how to effectively go back and change those priorities.
So sustainability, talked about this way, makes it a little bit less daunting. It's very daunting if you have 6 months left in your project and you're trying to come up with your sustainability plan. So this is how we work with sustainability, and it again intersects with all the components of the model. It really has 3 legs or 3 prongs to it. And the last one over here, the red one, is really about the resources and the funding. And a lot of times programs, we deal with stop and go funding all the time, and it's very frustrating. So we've had to build in, the things that we get in place, the community conditions that get changed. We have to build in that set of, we have to be focusing on those systems changes and making sure that accountability, compliance monitoring, et cetera, is in place when as things move forward. And so these guys gave a really good overview of the 3 prongs of sustainability, but I do want to just cycle back before we kind of move on to some questions and say that the model really, all the components of the model make up this framework that provides a structure, strategy, and intention to what we're doing. So just as you're working with sustainability in the beginning, not the end, and you're using media and taking full advantage of that tool, and all the other things that were mentioned today, that structure, strategy, and intention is what we hope you are able to take away with you today in terms of a framework for doing really, really challenging community work and basically fixing broken systems that have produced long-term inequities in our communities. And I'm so glad so many people were here, and that I hope that helps you in your work, because what you do is not easy. It's hard. And I think we have time maybe for one question, but what I'll tell you, since we didn't have that much time for questions, we will be posting the answers to the questions that came in through the chat on our Facebook page later today. So please visit our Facebook page, and you'll be able to get the answers to any questions that were put out or that you had. And we're also going to be sending you our equity toolkit this afternoon, along with the sources for the indices that Brittany mentioned when she was doing her mapping. But I'm gonna ask Meredith, who is our media director, to let us know if there is a question that we can take the last 3 minutes to address.
Hi, I'm Meredith Gibson, I'm media director at IPS and for the P4S project. I apologize, my video is not working. But we do have some questions that have come in. How have challenges of cultural and generational differences been addressed in recent community initiatives?
You know, I'd love to punt this to Jorge, because I know there is a lot of work that you guys have done. You've had your coalition for a long time, and that's always been really kind of something you guys do well.
From the beginning, we made sure that to make the coalition diverse, and we also deliberately invested time into positioning women into leadership. Also, we invested time in making it accessible to elders in the community so they could share their knowledge. We also dedicated time to listening to community members and especially elders that had been past organizers so they could tell us the dynamics of communities. And we move our coalition meetings around. Before COVID, we used to meet at different parts of LA every month in order to highlight different communities, neighborhoods, and to be open to diversity. So it was a very intentional and deliberate effort.
Thank you, Jorge. Next question is, why is media advocacy underutilized so much? What barriers are in the way of making sure it is used more often?
I can jump in and speak to that. I think a lot of times what happens is people are intimidated by media. It's not something that they necessarily have knowledge of how to do. People get, you know, people are afraid of public speaking, and they certainly are afraid of being interviewed by a reporter and that kind of stuff. But media, using news strategically, earned media to advance your work is not that complicated. And it's, but I think it's intimidation a lot of times. People don't know where to start. And I think media advocacy, we started as a media advocacy company. And so we're going to be doing some webinars and some trainings, and we provide some services around media advocacy. It's not that hard to do, but I think it's just not something people have that come into public health and focusing on the social determinants of health and stuff. They have lots of skills and lots of knowledge, and whatever your background is, there aren't always a lot of people with a media background doing the work we're kind of doing, but you don't need the media background. It's helpful, but anyone can write an op-ed and get it printed. Anyone can do a letter to the editor. You can submit news stories. You can host a media event. They aren't that hard. And so I think it's just getting past that, being that fear of, you know, media and news. And the social media people seem to jump into more easily, but we really would like to see people starting to use the news as a tool.
Well, and I know we're out of time, but I just wanted to hop in real quick to say, I think you're right, Brenda, that it can be intimidating, the concept of working with the media. But what we've learned is we are a resource to the media. They are looking for content. They are interested. You know, these fact sheets we've created that demonstrate the alcohol density as it relates to the LAPD reported crimes, there is genuine interest. So I think you'll find as you explore media advocacy in your own projects that they really are, you can become a resource, and it's a real relationship that it truly can be built upon, and that it's not nearly as intimidating as it would seem, because we're adding value for them as well as they're bringing value to our work.
And we bring authentic voices to them, and the media likes that. And it's what we need to help advance equity in our communities also. So we mentioned the equity toolkit that's going to be sent out to everyone who attended. And I think we have one more slide. And so we do have some services. We are going to be offering a series of free webinars. So keep checking back on our stuff, sign up for our newsletter, and we will, and you'll know what's coming out. And we really are, hope this time has been worthwhile to you, and we hope to see you again. And please visit our website. And check out our Facebook page, and send us any questions or feedback that you have. We've got our email addresses right here, and have a great day. Thank you.